These are the 4 sleeping positions that could be silently damaging your spine, making your sleep apnea worse, and turning your acid reflux into a nightly battle, along with the 4 positions that medical experts say actually protect your body as you age. What most people never realize is that the position you sleep in starts to matter a lot more the older you get. At 25, you could twist yourself into a pretzel and wake up feeling fine. But after 60, that same position might leave you with back pain, numb arms, or gasping for air at 2 in the morning. The numbers tell a troubling story. Nearly half of all older adults have sleep apnea. 40% report poor sleep quality. And when you look at adults over 75, almost 54% of them have arthritis that makes certain positions genuinely painful. Sleep position stands out as something you can actually change, which sets it apart from your blood pressure medication or your cholesterol levels. This is completely within your control. Today, I'm going to walk you through exactly which positions to avoid, which ones to embrace, and the simple pillow tricks that can turn a harmful position into a healing one. Let's start with the positions that could be hurting you right now. Section 1. The 4 worst sleeping positions. Worst position number 1. Stomach sleeping. Pay close attention to this section if you sleep on your stomach. Medical experts all agree on this one, and they call stomach sleeping the single worst position for your spine. Dr. Raymond J. Ha, a spine surgeon at USC, puts it bluntly when he explains that sleeping on your stomach flattens the natural curve of your back and puts the most pressure on your spine's muscles and joints. No other position stresses your spine quite like this one. Picture what happens when you lie face down. Your neck has to rotate 90 degrees just so you can breathe, which means for 7 or 8 hours your neck stays twisted to one side, straining muscles and compressing nerves the entire time. Your lower back loses its natural arch while your lumbar region gets pushed beyond its normal limits. Breathing problems make this position even more dangerous. Stomach sleeping compresses your chest wall and makes it harder for your lungs to expand fully. And if you have COPD or any heart condition, this compression becomes particularly risky. Studies reveal something fascinating about how elderly adults naturally behave. Research found that older adults only spend about 2% of their sleep time on their stomachs, which suggests the body instinctively knows this position causes harm. Forcing yourself to sleep on your stomach out of habit means ignoring what your body has been trying to tell you for years. Worst position number 2. Flat on your back without support. Back sleeping can actually help you, but here's the critical distinction you need to understand. Sleeping flat on your back with no support creates a completely different situation. Gravity works against you when you lie completely flat. Your tongue and soft palate fall backward, and that can cause your airway to collapse, which explains why back sleeping earns the title of worst position for people with snoring and sleep apnea. Dr. Nancy Schaefer of Cleveland Clinic points out that 25% of men and over 10% of women have sleep apnea. Studies measuring apnea events found a 30% increase for seniors sleeping flat on their backs compared to those sleeping on their sides. Breathing isn't the only concern with this position. Lying flat allows stomach acid to flow back up into your esophagus if you have acid reflux or GERD. And 4 out of 5 GERD patients experience symptoms at night when they sleep this way. That burning sensation, that coughing, that feeling like something got stuck in your throat, much of it comes from sleeping in the wrong position. My point here isn't that you should never sleep on your back. What I'm saying is never sleep flat on your back without proper support. Later in this video, I'll show you exactly how to modify back sleeping to make it safe. Worst position number 3. The tightly curled fetal position. This one surprises a lot of people because side sleeping generally gets recommended by doctors. So how can the fetal position be harmful? The key word to focus on is tightly. Curling up too tightly creates a whole new set of problems that cancel out the benefits of side sleeping. Joint movement gets restricted when you curl into a ball. Your knees press together and bend sharply. Your hips flex beyond their comfortable range, and your spine curves in ways it shouldn't maintain for hours at a time. The Sleep Foundation specifically notes that this position hits people with arthritis particularly hard. Nearly 54% of adults over 75 have arthritis, which means more than half of you watching this video right now. Chest and diaphragm compression reduces your breathing capacity when you curl up tightly. Physical therapist Kathleen Walworth explains that these positions become painful because they test your range of motion, and range of motion tends to narrow with age. Side sleeping works best in a relaxed lateral position rather than a tight ball. Keep your legs slightly bent instead of pulled up to your chest and give your joints room to breathe. Worst position number 4, arms raised or tucked under your pillow. This position gets overlooked all the time. Yeah, it creates dangers for seniors in ways most people don't realize. Blood flow gets restricted when you sleep with your arms raised above your head or tucked under your pillow. Younger people might just wake up with a numb arm, but seniors with circulation problems face increased blood clot risk from this restricted flow. Sustained strain on your rotator cuff adds another layer of risk. That group of muscles and tendons that stabilizes your shoulder takes 8 hours of pressure, and that pressure can lead to chronic shoulder pain and injury over time. Tennis elbow or carpal tunnel syndrome gets worse when you sleep with your arms in this position because it delays healing and compresses nerves that are already inflamed. The solution takes almost no effort. Keep your arms down at your sides or in front of you at chest level, and your shoulders will thank you in the morning. Section 2. Why aging makes position problems worse. Before we get to the better positions, understanding why all of this matters more as you get older will help you take these recommendations seriously. Dr. Rachel Salas, a neurologist at Johns Hopkins, captures the issue perfectly when she explains that for young, healthy people, sleep position matters less. But as you get older and have more medical issues, sleep position can become positive or negative. Your body changes with age in ways that make position choice more consequential. Kyphosis, which refers to increased curvature of the upper spine, affects 20 to 40% of older adults, and lying flat becomes physically impossible without straining your neck and upper back if you have it. Decreased bone density from osteoporosis makes your bones more vulnerable to stress from improper positioning. Pressure that younger bones could handle without any issue can cause real problems for osteoporotic bones. Joint degeneration from osteoarthritis reduces the cushioning between your vertebrae, which means less shock absorption and more direct impact on your spine from poor positioning. Weakened core and back muscles provide less support during sleep than they used to. Strong muscles helped compensate for poor positions when you were younger, but now your muscles can't protect you the way they once did. Reduced circulation turns blood flow restriction into something more dangerous. Temporary numbness in a 30-year-old can lead to blood clots in a 70-year-old. The reality of comorbidity adds another layer of complexity. Many seniors have sleep apnea, GERD, arthritis, and heart conditions all at the same time, and each condition has its own positioning requirements. Getting it wrong means aggravating multiple problems simultaneously. Finding the right position isn't about comfort anymore. This is about protecting your health. Section 3. The 4 better sleeping positions. Now let's talk about what actually works. These are the positions that medical research supports for older adults. Better position number 1. Side sleeping, lateral position. Side sleeping stands as the gold standard for seniors, and more than 60% of adults naturally sleep on their side for good reason. Dr. Viren Summers, a Mayo Clinic cardiologist and director of their sleep facility, states it clearly when he says there is a host of evidence overall suggesting that probably sleeping on the side is better. The Sleep Foundation adds something that speaks directly to aging when they note that the flexibility of our spine decreases as we age, which may make the side sleeping position more comfortable for older adults. Side sleeping delivers multiple benefits at once. Airway collapse gets prevented because your tongue and soft palate stay in place instead of falling backward, which means less snoring and fewer apnea events. Spinal alignment gets maintained when you use proper support, and your spine can stay in its natural position throughout the night. Some people with sleep apnea find side sleeping so effective that it replaces CPAP therapy entirely. Dr. Sarah Benjamin of Johns Hopkins notes that some patients can treat their condition with side sleeping alone, as opposed to using a continuous positive airway pressure machine. Here's the detail that makes or breaks this position. Side sleeping only works if you use proper pillow support. Dr. Summers emphasizes that if you don't have a pillow between your knees, that stress of sleeping on the side pulls on your hip and can cause some issues. Exact pillow placement comes later in this video. Better position number 2. Left side sleeping, specifically side sleeping, helps. And left side sleeping helps even more for certain conditions. A February 2022 Harvard Health study found that acid cleared much faster on the left side compared to the back or right side. Research published in the American Journal of Gastroenterology revealed something remarkable about acid exposure. Left lateral sleeping results in a median acid exposure time of essentially 0%, compared to 1.2% for right side sleeping. That difference matters a lot if you're dealing with acid reflux every night. Anatomy explains why the left side works better. Your stomach sits on the left side of your body, and when you sleep on your left, gravity helps keep stomach contents where they belong. Venous return to the heart improves with left side sleeping because blood flows back to your heart more efficiently in this position. Emerging research suggests that left side sleeping may even reduce dementia risk through improved brain waste clearance via something called the lymphatic system, which I'll explain in detail shortly. Better position number 3. Back sleeping with proper support. Flat back sleeping causes problems, as I mentioned earlier. Back sleeping with proper modification works excellently for certain people, and the difference comes down to support. Dr. Shailen Vera of Eat Southwestern calls back sleeping with support the gold standard for spine alignment. Adding a pillow under your knees makes all the difference. This simple change takes pressure off your lower back and prevents lumbar hyperextension. Dr. Andrew Bang of Cleveland Clinic explains the mechanics when he says that if your legs are flat, it can cause your lower back to arch too much, and that's especially true if you have tight hamstrings. Putting a pillow under your knees slightly bends your legs, which relaxes your hip flexors and allows your lower back to settle into its natural curve instead of straining against the mattress. Back sleeping with knee support works well for people without sleep apnea or with only very mild apnea. Those with significant back pain but no breathing issues get excellent spinal support from this position. People recovering from hip or knee surgery might receive specific recommendations for this position from their doctors. Never sleep flat on your back. Always use that knee pillow. Better position number 4. Elevated or inclined sleeping. Gravity solves multiple problems at once when you use this position. Raising your torso, not just your head, keeps your airways open and keeps stomach contents down where they belong. Research shows that even 7.5 degrees of elevation improves sleep apnea symptoms, while 30 degrees or more delivers optimal GARE relief. Several methods achieve this elevation. Wedge pillows come specifically designed for this purpose. Adjustable beds allow you to find your perfect angle. Bed risers placed under the headboard of your regular bed offer another option. Physical therapist Kathleen Woolworth offers a correction that many people need to hear. She says elevating just the head won't do anything, and that you want to get all the way down to the esophagus. Stacking regular pillows under your head doesn't work for this reason. You end up bending your neck at an awkward angle while your stomach stays flat. The entire torso must be elevated for this position to help. Section 4. Pillow placement, the key to everything. This is the part that can transform your sleep tonight. Proper pillow placement separates a position that hurts you from one that heals you. For side sleepers, 2 pillows at minimum are required, one for your head and one between your knees. The knee pillow is not optional. Remember what Dr. Summers explained about side sleeping without it pulling on your hip. The pillow keeps your hips, pelvis, and spine in alignment. Women may need thicker knee pillows than men due to wider hips, and the goal is keeping your top leg parallel to the mattress rather than dropping down across your bottom leg. Your head pillow should fill the space between your head and the mattress exactly so that your neck stays neutral, neither bent up nor bent down. Too thin a pillow drops your head and bends your neck, while too thick a pillow tilts your head up and bends your neck the other way. The right pillow height keeps your spine in a straight line from your tailbone to the top of your head. For back sleepers, the opposite setup works best here. Your head pillow should be low loft, meaning relatively flat, because a thick pillow pushes your head forward and strains your neck. A pillow or wedge under your knees becomes the essential addition, maintaining your spine's natural curve and preventing your lower back from arching away from the mattress. A small pillow tucked under the affected shoulder provides additional relief if you have shoulder issues. For those using wedge pillows, different heights serve different purposes, and knowing which height you need matters. A 7-inch wedge works for mild reflux and slight elevation needs. A 10-inch wedge serves better for sleep apnea and moderate GERD. A 12-inch wedge delivers optimal results for severe GERD, post-surgery recovery, or if you like to read in bed. An angle of 35 to 45 degrees provides optimal combined relief for snoring, apnea, and reflux. For those with kyphosis, don't fight your body if you have a rounded upper back and lying flat feels impossible. Side sleeping with a pillow tucked under your back curve for support causes much less harm than trying to straighten a naturally curved spine. Accommodating your body's shape works better than forcing it into positions it can no longer achieve. Section 5. The brain connection. New research. Before we wrap up, some fascinating recent research adds another reason to take your sleep position seriously. Scientists discovered something called the glymphatic system, which functions as your brain's waste clearance mechanism. This system removes beta amyloid and other proteins associated with Alzheimer's disease. What makes this relevant to our discussion is how the glymphatic system operates. It runs 60% more efficiently during sleep and drops 90% during wakefulness. Your brain literally cleans itself while you sleep. Dr. Helene Benveniste's research, published in the Journal of Neuroscience in 2015, demonstrated that glymphatic transport was most efficient in the lateral position when compared to the supine or prone positions. Side sleeping may help your brain clear waste more effectively than back sleeping or stomach sleeping based on this finding. Dr. G. Peter Glebus, a neurologist at Baptist Health, offers appropriate caution when he notes that this is not a direct cause and effect relationship, but rather a potential association that needs further research. A 2023 study found a relatively strong association between back sleeping and neurodegeneration, despite the need for more research. A September 2025 study in The Lancet analyzed 27,500 UK biobank participants and found poor sleep patterns associated with accelerated brain aging. Research from October 2024 reported that sleep apnea contributes to dementia development, particularly in women, with increased risk at every age level studied. Definitive proof that side sleeping prevents dementia doesn't exist yet, but the evidence points in that direction. Side sleeping already gets recommended for other reasons, and this emerging research gives us one more reason to make the switch. Section 6. The reality of sleep positions. Honesty about something practical is needed here. Nobody stays in one position all night. Dr. John Winkelman of Harvard, who has interpreted thousands of sleep studies, observes that rarely do you see someone sleeping in the same position all night long. Research shows elderly adults average 16 position shifts per night, with each position lasting about 33 minutes. The goal isn't staying perfectly still in one ideal position, because that's unrealistic. Creating conditions that make each natural shift beneficial rather than harmful is what matters. Setting up your pillows correctly before you fall asleep accomplishes this. Avoiding the positions we discussed as your starting position helps too. Understanding that waking up in a different position is normal and expected removes unnecessary worry. Dr. Nancy Foltbury-Schaefer states the principle clearly when she says the ideal sleeping position is going to vary based on an individual's needs. Dr. John Winkelman agrees and adds that we probably have to individualize this and that your body tells you what's best. Listen to your body and use discomfort as information. Back pain when you wake up signals your position was wrong. Numbness in your arms when you wake up signals your position was wrong. Gasping for air or acid in your throat when you wake up signals your position was wrong. Adjust accordingly. Section 7. Special considerations. Certain medical conditions require specific positioning that might differ from general recommendations, and this deserves mention. Hip replacement surgery may mean restrictions on side sleeping, at least temporarily. Knee replacement surgery may require keeping your legs straight, which could mean back sleeping works better for you. Heart conditions might make left side sleeping feel uncomfortable, and you may do better on your right side or on your back with elevation. Lung conditions could make right side sleeping problematic due to compression. Always follow your doctor's specific instructions if you're recovering from surgery or managing a complex medical condition. General recommendations in this video apply to otherwise healthy seniors, not to everyone in every situation. Conclusion. Let me bring this all together. Half of all older adults report sleep problems, and position plays a documented role in conditions affecting most seniors. Sleep apnea affects 46%. Arthritis affects over half of those 75 and older, and GERD affects 20 to 30% of those over 60. Sleep position stands out among health factors because you can completely control it. You can't change your age or always change your medications, but you can change how you position your body for 7 or 8 hours every night. Here's what to do starting tonight. Avoid stomach sleeping entirely because no modification makes it safe. Always use a pillow under your knees if you sleep on your back, and never sleep flat. Try to relax that curl if you sleep in the fetal position by keeping your legs slightly bent rather than pulled to your chest. Keep your arms down at your sides or in front of you instead of raised above your head or tucked under your pillow. Side sleeping works as the safest default position for most seniors, and left side works even better if you have acid reflux. Use a pillow between your knees for side sleeping, and understand this is not optional. Consider elevating your entire torso rather than just your head if you have GERD or sleep apnea. These changes take almost no effort. A knee pillow costs very little, and adjusting your position costs nothing at all. The impact on your sleep quality, your pain levels, your breathing, and possibly even your brain health can be substantial. Sleep position deserves a place in your healthcare conversations alongside diet, exercise, and medication. Bring it up at your next appointment if you haven't discussed it with your doctor. Consider sharing this video with someone you care about who might benefit if it helped you understand something new about how you sleep. Thank you for watching, and sleep well tonight.